My name is Rudy Darling, and I'm the Vice President of Operations at Baxter Regional Medical Center. I want to talk to you a little bit this morning about a program that we implemented in late 2013, a community paramedic program. In 2012, Gerald Cantrell, our Director of Ambulance Services, came to me about a community paramedic program that he had been reading about. Gerald and some of our other staff and leaders went to Dallas, Texas to look at their program and how it functioned, and came back and implemented our community paramedic program. This has been a great program for the people in our community that did not have access to care readily, and because of that, came back and visited our emergency room and were readmitted to our hospital because they couldn't maintain their health. This program has served several. It's helped our readmission rates, and we want to expand the program and continue to serve our community.
Gerald approached me soon after I came here about maybe implementing a community paramedic program, being a flagship for the state, based on the need in the community that we had, due to the fact that our elderly population, we have a lot of recurring sickness and a lot of recurring admissions to the hospital for chronic conditions, and the fact that Medicare was now starting to kind of look disfavorably on the readmission process. So we needed to look at a way to somehow maybe impact that and not have as many readmits.
One of the ideas behind this program was we identified a need of patients who were being discharged from our facility, and we needed to try to understand their health care needs. So part of our job was to find out how much they understood about their disease process, what kind of resources did they need once they were discharged from the hospital. Did they get their prescriptions filled? Have they followed up with their primary care physician? So we took that as part of our initial interview and our assessment, trying to coordinate this patient's discharge from the hospital back into their home to help them better manage their health, to allow them to avoid hospital readmissions, to benefit their health in whatever way possible. Our community program paramedics consist of paramedics and paramedic RNs at Baxter Regional, who we joined ventures with University of Arkansas Medical Sciences and provided these individuals an expanded role in education of furthered chronic disease processes, management, community assessments, health assessments, pharmacology, and other areas of the healthcare institutions. So we have expanded their knowledge base, a better understanding of long-term patient care, and we feel like that's been a benefit for our staff as well as our clients.
I was in the hospital with a heart attack, and the social worker came in and wanted to know if I would be interested. This was something new that they were starting. I said, yes, I would. So they came out in a day or so and did an interview with me, and also did an EKG at that time. And I felt real secure to think that there was somebody that I could call on and in need, and maybe wouldn't even have to go to the hospital. It would be taken care of right there. A time or two that you came out, also a time when you thought I needed to go back to the hospital, and that's when they found the pneumonia.
Right. But you didn't have to stay. You were
No,
able
I didn't have to stay.
You were able to come back home.
I was able to come back home.
Which was our goal.
Yeah, right. I feel more secure knowing that there is somebody that I could call on the spur of the moment. They would be there. They would advise me maybe what to do or whatever.
We all know that sometimes the 911 calls are necessary for emergency response and healthcare needs of the patient, which result in an admission. At the time of discharge, however, sometimes people fall through the cracks and from time to time don't qualify for home health agencies or other support. Therefore, we created at Baxter Regional Medical Center the Community Paramedic Program to address those people that fall through these cracks.
The Baxter Regional Medical Community Paramedic Program has been established to work in partnership with community health programs to help the underserved and the elderly population that may not have been getting as much care as they needed. Either they didn't qualify for home health, or were not, for some reason, could not get home health into their home for whatever reason. So that's where we became available to try to help these people upon going home, to have somebody, if nothing else, just to check on them, to help them get their medications, to make sure they're taking their medications correctly. We also offer some services back and forth to take them to their physician, to be an advocate for them, to kind of sit in their physician's office with them to help them understand. We also offer services to the patients who come to the ER, numerous visits for maybe non-emergent, events. They just didn't understand the system and they didn't have anywhere else to go. So now they're able to call our community paramedic, or the ER physicians and staff are able to call the community paramedic program and say, hey, we have someone we'd like you to enroll. They don't really understand their medical condition. Could you kind of help them, follow them out, and maybe keep them from coming to the ER, when they don't need to on a repetitive basis?
The community paramedic program at Baxter Regional Medical Center is based on referrals, and the referrals can come through the primary care physicians, through an encounter with EMS via ambulance or as any patient contact, also through the Klein Emergency Center staff, both physicians, nurses, and case managers, as well as other hospital staff such as the caseworkers within the organization.
Often when we meet with patients in the hospital who may have been admitted later or admitted for a different type of illness or procedure, tell us how supportive and how great their experience with community paramedic has been. There are times that we have re-referred patients to community paramedic. It was the right fit for resources on the first go-around, and often it is the right set of resources for them again.
I'm there by myself, and so when you guys come, it's like I say, it's just like family.
There's several times I have to weigh myself, do my vital signs, and I had gotten up one morning and I didn't feel right. I was a little dizzy and bumping into furniture, and I could not sit down. I just kind of plopped down. So I did all my vitals, kept monitoring them for a little over an hour, and then I called the 911 and told the lady that I was a member of the community paramedics program, and she immediately put me through to Phil. And I explained my situation to him and told him my blood pressure seemed to be dropping. They came out as quickly as they could get there, checked my vital signs, did an EKG, and where normally they try to keep us at home, he said, I just honestly don't think you can do this. You need 24-hour supervision. So I need to take you to the hospital. And that's exactly what we did, and it was a good thing because my pressure continued to drop some. I have several medications that are very expensive.
Right.
And Phil asked me the first day that he came to see me in the hospital about my medicines, and I told him, I can't afford them. I don't have that kind of money. And he asked what they were running me, and I told him what it would cost. And he said, I think I can help with that, said I'll be back. And a short while later, the social worker came in, and they had gotten together and called a facility here in Mountain Home that told me to come over in a few hours, that they would have at least 1 to 2 months worth of my medications waiting for me. And, well, you don't have that much on your Social Security, trust me. If they did not come out and check on me or call and check on me, then I could be there alone, because I do live alone and I am way out in the boonies, and no one would be able to find me for maybe hours or a few days even, because my closest neighbors are like a block or so away. But if I have a doctor's appointment, everyone will either call that day to see how the appointment went, what did the doctor say, or they will call the next day to find out for sure. And they still call and check on me, and still want to know about the medications, how they're doing, and still offering all the help that they can. A limited income, it's wonderful.
As you've had an opportunity to actually hear for the last several minutes about our community paramedic program, our primary goal and desire would be that it has allowed you to have a broader scope of what a community paramedic program can do within a community, but also my hope would be, or our hope here at Baxter Regional would be, from a broader perspective, that this would be a program that could be adopted not only here in Baxter County and Marion County, but throughout the state of Arkansas. Patients see value in the program, and I think you've heard that through results of this video, but there is a significant gap in the healthcare setting as it is now, and many patients are leaving healthcare settings, leaving healthcare institutions such as hospitals, not having anybody follow their course outside of the hospital setting. It puts those patients at risk for having exacerbations and putting the general population at risk just from the standpoint of not having anybody follow their pathway. I think it's very important that you understand that we work closely with every agency that is not only here in Baxter County, Marion County, but from a broader perspective, we are working with other state agencies also to try to promote this program. Thank you so much for allowing us to extend this program out to not only Baxter County, Marion County, but also the state of Arkansas.